If you or your athlete has had an ACL reconstruction with a peroneus longus tendon graft, this really is your return to sport guide and when this graft actually makes sense. First, let's talk about why surgeons choose PLT. The peroneus longus graft is strong, often gives a good graft diameter, and most importantly, it spares the knee. No hamstring harvest, no patellar tendon pain. That means less anterior knee pain and usually better early knee strength, which helps during rehab and return to sport. From a RTS perspective, PLT behaves very similar to a hamstring graft. Knee stability outcomes are comparable, and studies show no major loss of ankle strength or function in most patients, especially when harvested correctly. Now, when is PLT a good choice? Well, it's useful when hamstrings are small or already used, such as in a revision ACL surgery. A larger graft size is needed to reduce failure risk. You want to avoid anterior knee pain for athletes who kneel, squat, or load the knee a lot. In multiple ligament surgeries where extra graft tissue is needed. But PLT is not for everyone. You should avoid it or think twice before getting it if the athlete is a professional runner or jumper relying heavily on ankle power. There's a pre-existing ankle instability, flat foot, or peroneal tendon issues. In pediatric patient where long-term ankle data is limited, or if the surgeon is not experienced with PLT harvest. Bottom line, PLT is a strategic graft, not a routine one. When chosen for the right patient with the right rehab, return to sport can be just as successful as other grafts. If you want a PLT specific rehab or RTS checklist, comment PLT down below and I'll share it in your DMs.